last unit is the head. We'll start with the bones of the skull. Yeah, get plenty of time to copy this down. Get some more colors out. Now, we studied the skull, of course, in anatomy class. We break it down into all of its bones. The skull is pretty much one entity, though, despite the fact that we're studying each individual bone. So think of the skull as 22 fitted bones. The joints between the skull bones are immovable joints, and they're sutures. Joints between skull bones, use the term sutures. In other words, the fibrous tissue that binds the bones together is so strong, the joints are immovable. Don't move. Immovable joints. Of course, you can move your lower jaw. That's a movable joint, but most other skull bones are immovable joints. The skull has different parts. The main parts are the calvaria, which is the skull cap. The calvaria covers your noggin. It's your brain case, basically. Think of it like that. And brain case. It's these three bones. It's frontal, parietal, occipital. Check, check, check. Those are the bones that make up your calvaria, your skull cap. So just to illustrate real quick, let me get a couple of things from over here. So, your brain case, those three bones. When we perform a craniotomy, you do that to expose the brain. You cut the skull cap off. Expose brain. Now, it's been done for you. When you work with our skulls in the lab, it's been removed, okay, very simply. This is your skull cap. This is the calvaria. And you can even look and see, maybe even in the back of the room, that there are sutures holding these bones together, okay? When you remove the skull cap in a craniotomy, you just cut all the way around, okay? And you can even see the thickness of the flat bone. Okay. Remember, the structure of your flat bones is you have compact bone surrounding spongy bone. You should notice that when you look at the cross section of flat bones. So I assume you wrote this outline down. These are the 22 bones. We'll go through them. I'll erase it. Just want to remind you the structure of flat bones. You have many layers of compact bone, and you have all this trabecular spongy bone in the middle, and you have more compact bone. So, spongy bone, and then surrounded by a layer and a layer of compact bone. The whole point of removing calvaria, so you could reveal the brain, of course, when you're just studying the skull, brain has been removed, you get a nice look at what your brain sits on. This is called, what you're looking at here, the cranial base. Your brain sits right there on top of the cranial base. And when you look at our pictures there, I got a couple of views of that. This view here is cranial base, superior view, cranium removed, right? The craniotomy. So when you have a skull in the lab, okay, oh, that's that view. That is that, okay. So what's this view? It's the cranial base inferior view, mandible removed. So look at your skull. Oh, look, the mandible, they can come on, they can come off. Here's the mandible, your lower jaw, it's removed. So you look at the bottom, that's the cranial base from underneath. Okay, so that's that view of the skull. Okay, so those are the commonest views that you look at the cranial base from top and bottom. Of course, you can look at the whole skull from a lateral view or an anterior view. I think these are views that are familiar to you, right? Everyone's seen a skull at some point. But the only view not shown there is the posterior view. So, know your views of the skull. Study the cranial base. Both superiorly and inferiorly. The skull is important to study in addition to the bones because it houses the great sense organs. So everyone knows that the skull protects the brain. We have a whole lecture on the brain in the head unit, and we'll get to that. But also, like I said, houses the great sensory organs. Like your eyes for vision, olfactory sensations, right? Olfaction. It's the anatomy word for smells. It has your hearing and equilibrium apparatus in there. Hearing, equilibrium, apparatus, taste, your tongue is for taste, and Those things are all housed in different parts of the skull. So it's very important to study. And when you study the skull, study the skulls we have in the lab, study skulls articulated but also disarticulated. Study skull bones articulated in the skull. And disarticulated. So when I say study the skull bones articulated, just grab one of these trays. It's got the skulls in it. There's plenty over there. Look over there right now. Do you see 4 skulls that are colored? Yeah, and we'll color too. So colored helps you identify the bones, and because when they're not colored, you can still make them out, but it's harder to see. So the colored skulls may help you study them articulated. To help you study skull bones disarticulated, we have boxes. I got one out here. You saw where I pulled this out from, right? It's way back there. You didn't see where I pulled that out. I'll show you later. You grab a set for your group, and oh look, here's an individual. Oh, it's the occipital bone. Okay. Oh wow, look at that. That's my favorite bone. It's the sphenoid. Okay. And you're like, oh, well, what the heck? What is that? And you have to know, right? Oh, this is the temporal bone. Oh yeah, let's see. There's the skull, and I always go, oh okay, yeah, that's that right there. And I let go. Okay, let's see. Oh yeah, here's that bone. I look at it underneath. Oh yeah, if it's there. So you have to study it outside the skull, and yeah, kind of like what you did for the appendicular skeleton, right? You walked over there and see how it fit in the skeleton. So that's how you do it. Because I'll just take a bone and I'll just kind of lay it out there, and you have to be able to identify your individual skull bones and their surface features. So it's a lot of work, but you got to do it both ways. Do you see those blasted skulls? There's 2 right there. Blasted means they're disarticulated but almost together, right? There's 2 over there. So that's another way to help you study the skull bones disarticulated, study the blasted skulls. You could do it in your app, for those of you that use it. I think most of you do. Tap on one bone, do the whole skull, explode. There's a blasted skull. Okay, you got all the skull bones there. So you can use the app to help you do that too. So I'm just trying to show you how to study. I haven't even really started yet, but get there. So what I'll do now, unless there's any questions, I'll just kind of like to go through the study guide and go bone by bone and show you the bone and all the surface features that you're responsible for. First, to use this page, let's just color them in. Just the bones themselves, not the surface features yet. So on the first page of the study guide, we got the cranial bones. I guess I'll just write them again. Frontal, parietal. Occipital. Temporal. Sphenoid, ethmoid. And before I put a 1 or 2 next to it, because on the study list you have 1 or 2 frontal bones or parietal bones, whatever it is. So if I put a 1 next to frontal bone, that means it's a single. If I put a 2, you got 2 of them. The frontal bone is your forehead bone. Now I'm going to use red. On the anterior view, it's your big forehead bones. I'm just going to color in this whole thing here. That's your whole frontal bone. It's your forehead. From the side, your frontal bone is right here. Can't really see much of it from the inferior view. You can see it from the superior view. It's pretty much, let me trace it out here. Frontal bone. There's an ethmoid bone in the middle. Okay, it's kind of like all that area. There. So you can see part of the frontal bone with the calvaria removed. So that's kind of the frontal bone from different perspectives. Your parietal bones are the sides of your skulls. Use green for that. Doesn't matter what color you use, right? It's just orienting you to where these bones are. So your parietal bones is a broad, flat plate. Let me show you here. Look at that. It's a broad, flat, rectangular bone, okay? Parietal bone. And so, besides your skull, from the lateral view, you can see it the best. So I'll kind of trace this bone out here. Seen best from the lateral view. From the front, see a little bit here and here. From the superior view, cranium removed, it pretty much goes from here all the way back to there. There it is on one side. I'll trace it on the other side, because you got two of them. You can see a little smidge of parietal bone from the inferior view, cranium removed here. And this little part right there. So far you got the big bones of, we did this one. What's your forehead again? Just called the frontal bone. And then the parietal bone we just did. All right, the next is occipital. The occipital bone is the base and posterior aspect of your skull. I'll use blue. Base of your skull, posterior skull. So let's color it in. From the front view, can't see nothing because it's in the back. Here you can kind of see it on the back. Here. Back there. course, the best view is underneath, right there. Before I color that in, let me show you what it looks like right here. Looks like a seashell on the beach. It's the base of your skull. And it's kind of like, I'm holding it next to it, how it's viewed there. Okay. Occipital bone, so we can color it in here. There's a big hole in it right there, foramen magnum, we'll get to that. Brainstem, spinal cord come out of there. You got these occipital condyles, which you should remember from the vertebral column. Articulate with which vertebra? What's the first one? C1 atlas. Okay, we'll agree with that. So yeah, I don't want to color it in. Get the idea. That's kind of where it is on the bottom of your skull. You could, if you remove the skull cap, you could see that same bone from the superior view right here. Tracing it in blue. There's that big hole, foramen magnum, which means big hole. Got two little holes in there. We'll get to the surface features. I just want to get through where they are in the skull. So that's the base of the skull and the posterior skull, occipital bone. Okay. The temporal bones, you got two of them, a right and a left one. Okay, these are on the sides of your head. Okay. It's kind of right here. Okay. The temporal bones are your temples. From the lateral view, you can get a good view of it. Maybe about orange.
You've already done it, but did you get to do a craniotomy already?
Yeah, I do it on a good year, twice a year.
Yeah.
I do it. Yeah.
Oh, cool.
What you need is a bone saw. Bone saws are cool. It's an oscillating diamond blade, and it cuts through hard tissue. And if you put it on your skin, it's not supposed to saw, because when it feels soft tissue, it stops. Although I'm not going to test that on myself. Bone saws are what you use to perform craniotomies. Okay. So that's the side view. That's temporal bone, colored in orange. Let's get the other views. From the inferior view, you get a good view of temporal bone. Let's see here. That's an inferior view on one side for a temporal bone. And we'll color in the other side. trace it. Inferior view of that bone. On the inside of the skull, from the superior view, we can still see the bone right here. And on the other side. From the front view, it's kind of hard to see the side of your skull, but you see it a little bit right here. And on this side. So that's the temporal bones. Got two of them. They're the size of your skulls. So I used orange for that. Okay, sphenoid. Now sphenoid is it's the most beautiful bone in the body. It's this beautiful bat-shaped, moth-shaped bone. Looks like that. It's a single. Okay, it's kind of inside your head. So we can it's kind of like the back of your eyeball socket. We'll start there. Let's see what colors should I use. How about this brownish color? Trace this right there. So right where I trace there, that's the back of your eyeball socket. Okay. Do the other side. Kind of right in there. You can see a little bit of it on the side of your skull. There's a wing that forms right there. That's a piece of sphenoid from the lateral view. And trace that in there. From the inferior view, you can see it pretty good. Let me trace right here. So you can't see it underneath the skull. Yeah, you need to be able to look for it there. I think the best view is from the inside of the skull, but from the superior view, it's right here. Trace it all out there. Yeah, it covers all the views. The app is really good to kind of look at this bone because you have the fade out feature. Right now I have the occipital bone highlighted. Let me pull the shade down. So using the app, I have the sphenoid bone highlighted. You can see how it's kind of inside the skull. You kind of see it a little bit from the side there. And when I hit fade others, you can kind of see how it really is inside the skull there. Oh, thank you. I'm going to do skull and I explode. If you played around with that, can you see the sphenoid bone inside there when you blasted it out? That's why the blasted skull is good to use for trying to view those inside of the head bones. Go back to the app. Lights on. Okay, next bone is the ethmoid. And it's right around your nose cavity, really small. And it's very delicate. So like when you get our disarticulated bone things, they're kind of in here, and you got to use very gentle hands. And oof, so delicate. Paper thin bone. That's how big it is. It's right inside your nose. Running out of colors. How about I use little black? When you remove the skull cap and you got your superior view, well, this got moved a little bit. Let me move it back. A little better. Look for the ethmoid. I traced out a bit here because that's where the ethmoid is. Oh, it still got moved. Okay. It's better to use this in a PowerPoint so this doesn't get jostled. Okay, that's going to do it. It's right here. That's where it is. And in other views, we can see a little bit of it, although I think that's the best view. If you look in the frontal view, it's gonna would be, oh, this got moved. I don't know. I'm screwed now. Do you guys mind if I just erase what I have and just keep coloring? Yeah, because you guys got it colored, right? Yours isn't going to move. I think I know now not to switch back and forth. Anyways, here's ethmoid right there. And you can kind of see it inside the skull, this little bit right there. Inside the orbit. And on this side here, I got a little piece of it. You can't see it from here, but it's not even worth coloring. It's kind of like right here from the lateral view there. And you don't really see it from this view at all. So it's kind of hard to see. It's really best looked right there. That's the ethmoid. And that concludes what are called the cranial bones. The facial bones, if you have the study list, is the next page. So again, these are cranial, facial. Just as a category of bones. So your face, I mean, you know what your face is, your face. So that includes, starting with the lower jaw, mandible, your lower jaw, your upper jaw, maxilla. Now you got one mandible, but you have two maxilla. So, the two next to that, and you have much smaller bones, palatine. Got two of those. Lacrimal. Got two of those. Nasal bones. Two zygomatic bones. Two inferior nasal conchae. Two of those. Vomer, one of those. Let's start with the mandible. I have orange here. Your lower jaw. As the lower teeth, I won't color in the teeth. Okay, it's got sockets for teeth, but it's not part of the mandible bone. So that's your lower jaw there. On the side view, you can see it right here. Lower jaw from that view. And you cannot see it from the other views because it's not there. The maxilla is pretty much your central face. I'll use this pinkish color. The anterior view is the best view of these two bones of the face. one side. This is your upper jaw. It's got your upper teeth. There it is on one side. That's one maxilla, and I'll trace it in on the other side. You can see it forms around your nose. It's like the medial inferior aspect of the bony rim of your eye socket. It's right in the middle of your face. It's your central face bone. Maxilla. Palatine. Palate, the roof of your mouth. It's actually the back of the roof of your mouth. They're very small L-shaped bones. They're very difficult to see in the skull. I'll use green here. Doesn't matter what color you use, but I would say the best view for palatine is the inferior view, mandible removed of the cranial base. Forming, here's the roof of your mouth right there. Maxilla helps form the roof of your mouth. I should have done maxilla on this view too, so let me backtrack, sorry. Let's do maxilla from this view first, then I'll do the palatine bones. Okay. Go back to my pink color. Here's maxilla. Okay, so what I traced in purple, that's still maxilla. And you can see that, let me get my pointer. I can't find my pointer. Big disorganized mess. There's a ruler right here I'll use. All right, so this is part of maxilla. So it connects with right here. Those are your palatine bones. That's what I wanted to do next. So for palatine, I chose green. I'll stick to that. So that's the palatine bone colored in green. It's like the posterior 1/3 roof of your mouth. There it is. Then you have your very small lacrimal bones, which have the distinction of being the smallest bone of the skull. I'll use blue. So look on the medial eye orbit. There's a little sliver right here that I made, and right here. On this view, what I'm coloring blue is your lacrimal bone. Medial eye orbit. That's where you look for the smallest bone of the skull. Your nasal bones I'll use red. They're the bridge of your nose. They're not your nose. Your nose is skin and cartilage, but the bridge of your nose are the nasal bones. Your nose hangs off of it. So I'll trace right here. Small bone forming the bridge. That's one. And then here's two on the other side. There's the nasal bone from the front, and from the side view, you can see a little bit of one right there. The zygomatics are your cheekbone. I'm going to use green again. From the side view, you can see your cheeks quite easily right here. That's your cheekbone from the side. And from the front, right here. From the superior view, cranium removed, can't see it. From this view, we can see a little bit of the zygomatics. They're right here. Zygomatic here, and zygomatic here on the other side. But best seen from the side of the face. Last two, inferior nasal conchae. Look for them on the inside of your nasal cavities. I'll use pink. I'm just going to bubble them in right here on the inside. Kind of hang off the side of the nasal cavity, and they kind of stick out in there. You breathe in air. The conchae help break up the airflow to slow, warm, and humidify air. So they're inside your nasal cavity there. And then Vomer is also inside the nasal cavity. Orange here. So for Vomer, when you look down, there's I drew a partition right down the middle. There's one coming up here. That's Vomer. Also look for it from the inferior view, cranium removed. You can see Vomer right here. That's probably the best way to see it, I think. Inferior view, mandible remove. I wouldn't look for it anywhere else. I want to go back. Inside the nasal cavity, you can see a little strip of ethmoid. The ethmoid forms part of the nasal septum along with Vomer. So I'm going to draw, I used black before, so ethmoid also right here. Strip. And also ethmoid, these structures right there inside the nose. So again, black was ethmoid. And hopefully the color helped orient you. I mean, it's not like you know it now, but at least you know that the skull bones exist and have some idea where to locate them, depending on what view you happen to be studying. So what I want to do now that we've just kind of gone through the names of the bones, are there any questions? Well, now we need to learn the surface features of the different bones. Flip the page. Frontal bone. I have the superior orbital margins. Your eye orbit is the bony rim around your eyeball, and this is the superior part. So I'll just describe this as the superior bony eye orbit. My description is almost restating the surface feature. Okay, so let me just kind of color it in, or I would put the tape, or a lot practical, if I use green. So I just kind of zoomed in on the anterior aspect. I would just color it right there. The superior bony rim of your eye socket. You can palpate yours, right? You feel the bony part of your eye orbit. It's part of your frontal bone. Then there's a little notch kind of within that margin. Superior orbital foramen or notch. Depending on the skull you have, it may appear as a hole, foramen, or not a hole, just a notch there. It depends. I use pin. It transmits a nerve we'll talk about that helps you feel your upper face. We'll get to that. Anyways, I made them a little bigger here. I drew them as foramen, not notches. Right there and right there. And then I have the anterior cranial fossa. The cranial fossa, let me first describe why you study the cranial fossa. Cranial fossa AE, because there's three of them. There's anterior, middle, and posterior. There are depressions inside the brain. The brain sits in them. Fossa means suppression. So if you look at the cranial base, superior view, there's all these depressions in there where the brain sits on top of it. So that's why we study them. The anterior cranial fossa are actually part of the frontal bone. When we study the brain, what we'll see is these, this space, it supports the frontal lobes of the brain. Supports frontal lobe. So let me kind of pencil in this space. How about I use blue? You'll see depressions right in kind of like cross-hatching blue is where to look for the depression when you look at the skulls in the lab, okay? Anterior cranial fossa. And I'll have to put a big piece of tape there and I'll say on a test or a quiz, identify fossa, quote unquote. That's your hint word, right? I'm going for this. Because there's also middle and there's also posterior cranial fossa. Anyways, those are the things I want you to know on the frontal bone. For the parietal bone, I want you to know the sutures. Let's see, do I have that? That's my next page. I have occipital bone next. For parietal bone, go back to our previous page, and you can add to it. I won't make it so you can't know it. I'm going to zoom in on the lateral view right there. And what I'm going to do is I'm just going to trace the parietal bone again, and we'll see that it has 4 sides. And those 4 sides create 4 joints or sutures with the bones that are next to them. So for parietal bone, remember you got 2 of them. I want you to note squamous suture, coronal suture, lambdoid suture, sagittal suture. These are joints with neighboring bones, the sutures. Squamous, coronal, lambdoid. And sagittal. For the squamous suture, it's going to form a joint with a temporal bone. So it's just the inferior margin. Well, let me kind of like trace it for you so you see what I'm saying. I'll use green for this suture. Here's parietal bone. Here's temporal bone. So that suture right there is the squamous suture. They're jagged sutures. It's bone to bone like that. Okay, so that's when I say squamous suture, if I point to that border, that's the squamous suture. Okay. Coronal, frontal plane. That's this plane if you cut. So this suture is in that plane. I'll use blue. You can just point to it, but it's this border right here in the frontal plane. So what's the bone it's articulating with at that suture? Frontal bone. Right? Forms a joint with frontal bone. That's that side. In the back, it forms the lambdoid suture. I'll use red there. So you can see the back right there. So that's the Lambdoid Suture. And what's the bone it's articulating with back there? Occipital bone, very good. Forms a joint with occipital bone. And at the top, it's going to form the Sagittal Suture. It's going to articulate with the Parietal Bone on the other side of the head. It's in the sagittal plane. Okay, so that's the Sagittal Suture. Forms a joint with other temporal bone. I'm sorry, forms a joint with other parietal bone. I misspoke, sorry. So the app will really help you kind of see that better in 3 dimensions. Let me highlight the parietal bone. Here's the back of the skull. Do you see the parietal bone highlighted on one side? I want you to know why they call it Lambdoid Suture. Tell me if you see this Greek sign lambda. Do you see that? Yeah, it's pretty obvious once I point it out. That's a lambda. But anyways, we call this the Lambdoid Suture. What suture do we call this? Sagittal. Yeah. All right, I'm going to move on. Next bone is Occipital Bone. I got the app open. I'm going to do the Fade Others feature. So do you see why we call Occipital Bone posterior skull and base of skull? Look at the fade out. It's the base of your skull as well as the back of your skull. Okay. So this bone forms base of skull and posterior skull. All right, let's look at the coloring book to see the surface features there. Okay, so occipital bone. The surface features I have, let me list them here. Erase that as well. brainstem, spinal cord exit. The exit here. And so it's just the big hole. I'll use red. Foramen, magnum, the big hole, can't miss it. The next surface feature, occipital condyles. They articulate with C1. And you can see them on the inferior view. How about I use blue? Right here. Occipital condyles. External occipital protuberance. That's the next one. External occipital protuberance. It's a little bump on the back of your skull. I'll kind of like bubble it in. First, let me tell you, it's an attachment point for trapezius. There's a lot of muscles there. I'll just give you that one. Trapezius attaches there. You can move the skull backwards, move your head back by attaching there. And so I would kind of put, I'll use orange. I'll put the piece of tape. It's kind of this ridge right there. If you see a piece of tape anywhere in this vicinity on this bone, right in the middle, that bump, you can palpate it, it's right there. External occipital protuberance. Next is hypoglossal canals. I'll use green. You can see them from the superior view. You can see them from here too, but you kind of have to look for a little hole inside there. It wasn't illustrated that way. But here, I drew them in right there. They transmit a nerve called, well, it's cranial nerve 12. When we get the cranial nerves, you'll see that. CN, cranial nerve 12, XII, exits here. So you got two of them. Cranial nerves are paired. I'll teach the function of the cranial nerve later. Just for now, know that they exit the hypoglossal canal. Okay, I also have posterior cranial fossa. Posterior cranial fossa. They support the cerebellum. I'll use blue to show you. You can see them on the inside of the skull. Superior view, cranium removed. I'll kind of pencil them in here. You'll see these deep depressions on the inside. You'll see these deep depressions kind of like that. I drew it in how the depressions kind of look when you examine the inside of the skull, just like that. Okay, it's fairly obvious. Yeah, I think that's a good place to stop. When we come back on Wednesday, I'll continue to go through the surface features for the rest of the skull bones that are on your study list. When we come back from break, remember you have two things to study. The skull, start studying that, but remember your lab practical for the lower limb is when? It's Monday. It's Monday. So when we come back from break, you'll just have time to study skull and for that. Come back at 9:15.